What's up, Sweat family? Welcome to the Situationship. Another day, another video. So I shared this as a post sometime last month, around March April. And it was all about what to look for when consulting a general physician or a certified dermatologist for sweat treatment. These are just but few important things to consider and to put in mind. Are you ready? So nitakuwa ninaangalia screen yangu hapa as I read them through. So each point with a brief description. So let's do this. Oh, and by the way, like, subscribe, and share this video with your family, friends, and loved ones. But most important, learn. If there is any question, feel free to leave it in the comment section. So let us do this. The things to look for before booking an appointment with a dermatologist or a general physician, GP, a general physician, for sweat treatment, consider the following. Does he or she know hyperhidrosis? Huyu mwenye una consult, the general physician or the certified derma, do they understand excessive sweating and other sweat-related issues? Okay. The important, or why is it imperative, if I may use that word, why it's imperative is because of the following. They need to ascertain your type and category of sweat to rule out possibility of any underlying issue or underlying causes. So if they do not know your type or category, watakusaidia kivipi? This is why most people fall under severe misdiagnosis, because the person you consult, the medical practitioner you consult, does not understand excessive sweating. So it's important that they know excessive sweating, hyperhidrosis, and other sweat-related issues for them to be able to provide you with the best treatment options. To conduct, number one, they need to conduct background checks, sweat diagnosis, check on your history, sweat history, to note whether it runs in the family. Are you the only one? Ni wewe peke yako? Unaweza pata wewe una sweat kwa uso na home kwenyu, kuna mwingine ana sweat kwa mikono, mwingine miguu, others wengine kwa makwapa, the underarms and other areas of the body. So inaweza kuwa it's something that is genetic, it's in the family. So it's very important that they understand some of these important protocols. Na the only way itakuwa ni kama anaelewa. You cannot provide treatment for a condition you don't know. So it's important they understand excessive sweating. Number two, has he or she encountered several patients with excessive sweating and other sweat-related issues? If they have encountered different patients, anajua huyu alikuja with hyperhidrosis, maybe palmar, plantar, axilla, or Hexel's hyperhidrosis. Mwingine alikuja na bromhidrosis. Another patient came in with chromhidrosis. Another one with body odor issues. So they need to substantiate all and differentiate all these patients with the level of sweat issues that they have. Kuna wengine tu wenye their sweat is more of emotional. It's emotionally triggered. By encountering different patients, they will be able to know how to administer treatment. So it's very important akuwa amedeal na several ndo ajue how to manage your situation or your situationship. Number three, do they do sweat background checks or are they quick to provide treatments? Ukiendea any general physician or a dermatologist and they're just quick to throw in treatments, ila unakuambia kwanza the most commonly thrown treatment will always be Botox. You know there is Botox. You can go for Botox. If they're too quick to throw in treatment without going through and checking your background, then hapo sasa kuna issue. It's important. They need to do a background check. Na background inakuwaga unaanza na family history. Because as we know, 2 to 3% and more accounts for genetic hyperhidrosis. So zapata your father or your extended family kuna mwenye alikuwa nayo. Sasa na wewe pia uko nayo. Family check, background check is very important. And then number 2, unakuja into, you know, the areas where they sweat. And then number 3 is to, you know, ascertain the rate of the sweat. Is it mild, excessive, or extreme? Have they ever consulted a certified dermatologist for treatments? Because we have patients who self-medicate. Zanaweza kuwa wamekuwa akitumia oxybutynin or any other oral prescription medication, you know, anticholinergics for hyperhidrosis. So it's important to take note of all this. Sababu hii ndio itakusaidia ku arrive at the best treatment option for your patient. So apart from asking them whether they have ever consulted a certified dermatologist, the next thing will be, have they ever used any topical treatments? And topical, we are talking of clinical, prescription strength, antiperspirants, lotions, gels, deodorants, and liquid roll-ons, antiperspirants. Have you ever used any of those? Including antiperspirants, which are clinical to manage excessive sweating from areas where people are too embarrassed to talk about, such as the groin and the bum, you know, the trunk, makalio. Ni muhimu sana for them to inquire, to run those background checks. Very important. And in the process, pia, to ask them if they are willing to go on that journey for treatment. You know, are they willing? In case the treatment option the treatment option that will be suggested to them, if it doesn't provide that instant effectiveness, are they patient to go through with the next level? Because as we all know, effectiveness depends on body chemistry. How my body receives treatment is not the same as yours, and vice versa. Number 4, do they conduct medical tests to rule out possibilities of underlying causes and ascertain your type and category of sweat? Let me repeat that. Number 4, it's a very important point. One which you should always be on the lookout. Do they conduct medical tests to rule out possibilities of underlying causes and ascertain your type and category of sweat? There are 2 types of hyperhidrosis. There's primary focal and there is secondary generalized. Primary focal is the medical condition itself. It's not a side effect to a medication or an underlying medical condition. It has no cure or permanent solution, but can be managed through treatments. The treatments usually are the level 1 treatments. We are talking of topical treatments, antiophoresis machine treatments, and medical treatments. It affects both the left and the right-hand side of the body, meaning it's symmetrical, relatively symmetrical. So we are talking of both hands, feet, underarms. So huwezi kuwa una sweat to only one side, it's both. That one, the PFH, primary focal, has no cure or permanent solution. But when we come now to secondary generalized hyperhidrosis, this sweat is as a result of an underlying medical condition or a side effect to a medication. So there are certain medications whose side effects will lead to excessive sweating. And there are medical conditions such as cancer, typhoid, heart issues, hypothyroidism, when you have an overactive thyroid gland yenye kwa hapa kwa shingo, Parkinson's disease, infections, TB, malaria. There's a whole list of medical conditions and medications that could lead to excessive sweating. So medical practitioner mwenye umeconsult lazima conduct hizo medical test to ascertain ndo ajue sasa we are dealing with primary focal or we are dealing with secondary generalized. And then pia kuna possibilities of secondary factors. Secondary factors now will include emotional sweating. Emotional sweating that is being triggered by emotions. When you're stressed or you're when you're anxious, and when kuna hiyo anxiety, when you're depressed, so hapo hivyo hata kuna kuwaga na some clinical diagnosis to rule out is your anxiety situational or clinical. Number 5, they administer treatments in levels in order to achieve satisfactory results in sweat reduction. Remember, when it comes to hyperhidrosis treatments zinaenda na levels. Kuna level 1. Level 1 will be the use of clinical prescription strength antiperspirants. Alafu tunaenda tukimove another level, which is antiophoresis machine treatment. From there, sasa unaenda medical treatments, where now there is the certified dermatologist or the general physician will prescribe for you anticholinergic medication for hyperhidrosis. These are oral medication. The next level sasa ndo tunaenda to other treatments such as Miradry for the underarms, which is considered the best solution for underarm sweating with odor. Zinaenda hivyo in levels. The only level that I do not talk about and I don't even mention, if you haven't realized, I do not touch on surgery. But it's part of the treatment levels, but I do not touch on surgery because of that's the ETS, endoscopic thoracic sympathectomy, is atrocious. That's why I don't even touch on it. So treatments is in a level. If one level doesn't work, we move to the next. But you as the patient, you must be patient. Be patient with all these levels. And trust me, they do work because they have worked for several people. Number 6, do they do referrals in case they are not conversant with the treatment? So umeconsult dermatologist ama general physician, alafu amekuangalia hivi akaona, hey, you know what, let me refer you to Dr. X because Dr. X is a specialist who can best address your sweat issue. That is a very good doctor. Sababu anaadmit enyewe ile knowledge vile ninaweza approach the diagnosis ama the way I can approach your sweat issue will not be as best as an expert will do. So I'd rather we expert a take over because they will take you through the whole process. So it's better for them to do referrals. A good doctor will do that. From my own perspective, that's what I believe. But they should be able to. Number 7, are they aware of the available and not available treatment options, including the treatment budget? So what are some of the available treatments in Kenya and those which are not available? In Kenya, topical treatments is equal, thanks to Hyperhidrosis Awareness Kenya. We have Botox injection, which you can get from a certified dermatologist in their practice. You can get from them. Antiophoresis machine treatment, kuna zenye unaweza pata kwa hospitali, but as HAK, we always recommend the hyperhidrosis family, our clients, to buy their own devices. With the device, you can be doing your sessions at home, at the comfort of your home. You're pale, listening to some classical music, or enjoying your wonderful movie, or even enjoying your catalog of your best music. Only thing you need to do is 20 minutes of your session. And depending on the device you buy, you can do both sessions at the same time. You know. And for the treatments which are not available in the country, we don't have Mirror Dry in Kenya. We really don't have Mirror Dry. We don't have ETS. I believe there's some surgeons who do, even though the biggest issue is ETS is unregulated. So there are doctors who can do it. It's unregulated. That's why I don't like speaking so much about it. But for the treatment that we don't have in the country for excessive sweating, we don't have Mirror Dry. If there are other topical treatments that we don't have at the moment, it's Cubrixa. Those are topical wipes. What they did, they took glycopyrrolate, anticholinergic medication, na wakaiweka kwa clinical wipe. Your wipe haiko in the country, though yes, we can get it for a client, but it's very costly. But we don't have that in the country at the moment. If there are any other treatments, I'll do a separate video. In fact, I think I should do a separate video on the available treatments and the treatments which are not available in the country. Yeah. Moving on, number 8. Are they able to assist you achieve a treatment plan? As in wewe na huyu dermatologist mkikaa chini pamoja, anaweza kusaidia ku come up with a treatment plan. And the treatment plan, is it something that the certified dermatologist or the general physician will even make follow-ups to see you through the success? The success of having your sweat reducing to a point where una sweat like a normal acclimated person. Is a progress, checking up. Do they do those follow-ups weekly? Can be after a week or two, or after a month, depending on the prescription yenye amekuandikia. You know, point to ponder, right? And number 9, are they aware that not two people sweat exactly the same? Are they? So inamaanisha vile mimi nina sweat na wewe is not the same. Kuna mwenye sweat yake ni bromhidrosis. Kuna mwingine mwenye ana sweat in more than 3 areas of the body. Kuna ule mwenye sweat yake ni mild, mwingine ni excessive, ya mwingine ni extreme. So lazima pia waelewe that not two people sweat the same. So those 9 points I came up with, they should, you use them as a guide. Anytime unaenda kuconsult daktari, zitumie kama guide. Uangalie ule daktari mwenye unaenda kuconsult, you can just do a brief search. You can even inquire from people. Hata unaweza enda pale kwa reception unauliza, and the daktari, has he or she ever encounter patients with excessive sweating? Uliza tu, making an inquiry, see, it's not a bad thing. Remember, it's for your own good.